So today we're going to be checking out what do Americans think of socialized medicine, also known as universal health care. At least I'm under the impression that socialized medicine and universal health care generally means the same thing.
I mean, that's what I always thought, but I don't know if it's true.
But up until a recent video we did, I was under the impression that although I knew universal healthcare systems would work a little bit different in different countries, we learned that not every universal healthcare system is fully ran by the government. Some actually are private in nature, which is mind-blowing to me because I still don't quite grasp how some countries can actually have a universal healthcare system that is at least partially private, because I just assumed universal healthcare would basically have to be government run. But there must be something about how the government actually regulates the private healthcare industry, and then everybody is, taken care of under this umbrella, but it's actually still provided for by insurance companies or something like that. I have no idea how that works. We just learned a little bit about that recently.
Yeah.
But what do you think most Americans in this video are going to say about socialized medicine?
To be honest, I have no idea. Probably, I don't know. I guess it depends on where and who they're asking. I feel like if you go to like a bigger city, people will be like, oh yeah, I think that's great. And then people who like maybe more rural, you might find more people resistant to something like that.
But guys, I just was very curious on what Americans would say about a socialized medicine system in general, because obviously we don't have that here.
Right.
I think we have some good and bad in our system, just like every system does. But the one thing I think most people agree with here in the U.S. is that quality of care is pretty good, but the prices you pay, the prices for insurance and whatnot, it's just insane. And we really need to do something. We need to look at systems outside ourselves to really figure out what a system would look like that would work here. Because I don't think, remember the last video we looked at, I remember them saying that these were health experts, health economists or whatnot, and they said that you couldn't just plug and play one system into the system.
Right, because different
everything.
Yeah, different sizes of a population, different cultures all have different needs. But
it's time for us to look at some way to reduce costs at the very least in this country.
Yeah.
And so, anyways, guys, enough rambling. Let's go and check out what do Americans think of socialized medicine. New York City.
I guess that makes sense.
What do you think about socialized healthcare?
I do not like the idea of that.
Okay, that is definitely not a New York City accent.
I was going to say, yeah. Well, that's what I meant when you asked, like, what do you think people are going to say? And I said it depends on if they're, like, in a big city or country. I was thinking they were going to have, like, people from other places wherever they were.
Tourists.
Yeah.
Well, she's from down in my parts where I'm originally from, right? And she said she does not like the idea of that.
But you also noticed she said socialized instead of universal healthcare.
Yeah.
I don't want the government picking what I can and cannot do.
Well, my husband's from Europe, so I think it's pretty good, actually. I think a lot of people are covered by it. Everybody's covered. They don't have to worry about paying for it.
It's definitely more accessible for everybody. It allows all of us to remain healthy, to live long lives as much as we can.
I think it's kind of a necessity that the government provides health care for its citizens.
If everybody has something for free, who's going to pay for it?
Okay, what if people pay for it by taxes? What do you think of that?
Well, that's going to increase. Do you like to pay taxes?
Well, you are going to pay for it at least during your working life, unless
that's why I don't like when people say it's free, because it's really not free. But at the time of service, it's free.
Well, it is free once you're retired.
Yeah,
in a situation that's universal health care because you're no longer paying into it.
You're still like. When he said, do you want your taxes to go up? Well, we pay plenty in taxes already. I think they can allocate what we already pay and give us something for what we're paying.
Well, that's my pet peeve. If we want to talk about this, like, how much money our government spends every year on so many things.
Frivolous stuff that
has nothing to do with taking care of citizens.
I don't want my money spent on. Yeah.
So much money leaves the country that could be used to provide for the citizens of this country, and they just don't.
Yeah.
UK government provided universal health care. which is paid for through a tax based on an individual's income. That's your average payment's about $250 to $300 a month.
So first of all, let me ask you, do you know what the NHS is?
No.
They regulate and provide national health services for the UK.
What do you think the average copay is under the NHS?
I can't imagine it goes any lower than 30.
The amount for me is like $120
For a copay?
to see my family physician.
And so based on that, what would you guess would be the price there? Similar?
Probably, I would say probably higher.
You think higher?
It's actually, there isn't a copay, so it's $0. Or do you know if you get healthcare if you're not a citizen, do you think, under the NHS?
Isn't there certain protections, but not all of them?
You actually do get healthcare if you're not a citizen. What about if you're homeless?
Yes.
Correct. What about specialized costs, or specialized care, like an inhaler or an EpiPen?
In the UK, for inhaler or prescriptions, and I'm just guessing, at the most $20.
I'm guessing UK doesn't pay anything, which really sucks because we pay a lot.
I would say it's probably higher.
Considering what it costs here, I'm going to ballpark that at also another 25-ish.
Okay, it's actually £9.
£9.
For any medication.
Oh, it's a
which
flat
is
rate.
about $12.
I heard that.
Okay, so they are cheaper.
So they are cheaper.
A little bit, just a little.
What do you think of that?
I am still for
This poor lady. She is adorable. But, oh Lord, she's having a hard time facing the truth, I think.
individual in medical care.
The U.S. and every big. Oh my goodness.
That is insane and should be
That needs-
illegal.
that-
That should be illegal.
That's to save someone's life, man.
Yes.
Like it really.
That's disgusting.
Like here's the thing: we can talk all day about different types
forms of healthcare.
Right.
Yeah.
But there's a few things: EpiPens, insulin for diabetics, things like that should absolutely.
Life-saving medication.
You shouldn't have to think about it.
Yeah.
Like, come on. Those are where I like.
You shouldn't be able to price gouge and profit off of that.
No.
Not to that
In
degree.
2025, those should be things that absolutely are covered by, for free, no matter what. Doesn't matter on insurance, doesn't matter anything. If you need this to survive, now, generally speaking, I don't personally know anybody who's ever been denied the ability to get EpiPen, even when they were low income, because low income people get on Medicaid and then they're provided for free. So most people can get access, but nonetheless, again, it's like middle income.
People in the middle, yeah.
That
are the ones
struggle.
who get stuck with
Yeah.
the bill for everything.
Yeah, it really is. Best-selling heroes cost an average $250 to $300. God, $11,000. By the way, guys, this is a few years back, so it's probably more like 15 or something at this point because everything is going up.
And that's average.
Yeah. I mean, I think if you had a cesarean or something like that, it would probably be
way
insanely more. Yeah.
It's a surgery, so.
Now, if you with insurance and whatnot, depending on your deductible and stuff, that number's obviously going to go down. But if you got a really high deductible, well, different story.
Yeah.
So have you ever avoided seeking health care or treatment or medication or any sort of health service because of the cost and you were worried about having to pay some sort of fee?
Yes, I have experienced that a lot with patients that come in with pneumonia but have been at home for a matter of 5 days.
She a doctor?
And came in
Or
when it
a
got
nurse,
worse and had to be
maybe.
admitted to the hospital. And we're like, why didn't you come in sooner? Well, I couldn't afford this bill, so I was trying to take care of myself at home first.
Even just at school, I know people who, let's say, don't have the student health insurance plan, won't go get, let's say, contraception or things like that because they don't really want to pay for it out of pocket.
I found out later that I had sprained my ACL. I couldn't move, but I also didn't want to call an ambulance.
Whoa, no, yeah.
So what'd you do?
I got on my friend's back.
But my sister, she has
Are you
a lot
serious?
of allergies. So instead of using the ambulance for her anaphylactic allergies, we have to drive her, which is very scary because you don't know about traffic or anything. You don't have the same privileges as an ambulance on the road.
Have you ever not sought treatment because you're afraid of a cost?
No, ma'am.
Do you know anyone who has?
No, ma'am.
What about people who are afraid of the cost of, say, an ambulance?
Okay, that happens all the time because we have so many Americans.
This lady, she's just precious. She's in denial about a lot, I think.
A little bit.
But, yeah.
You know, like, this is one of the things that I wish people could understand specifically in the U.S. It's like, you don't necessarily have to support, like, everything about a situation or a system or what you think the system is to
admit the fault in your own.
Yes, you can admit that there are faults here, a lot of faults, but and you can also say
still disagree with having universal health care for whatever reason.
Right, but you not even that. You can literally say there are this and this faults in our system, but there's also some good. Yeah, you can say I've had a pretty good experience with getting care or whatever, but we I understand that the system itself is broken. Like two things can be right at the same time. True. And yet too many people have to go all in on whatever their decision is, and that's unfortunate because when you go all in on something that is broken, it means you cannot step back from it, look at it, and be like, how can we solve this to make it better for everyone?
Objectively, yeah.
And that don't want to go in debt, and they're trying to save money, and they think they can go buy a car instead of an ambulance.
Wait, what?
So what would you think
buy a car.
If that service was free?
If that service was free, anything that's free, sometimes it's not worth it.
Come on. I mean, I understand I understand what she's getting at to a certain extent. Like a lot of things that are free, there's like
a lot wrong with it,
right?
Yeah.
But this is what's wrong with calling universal healthcare free healthcare, because then people can't understand it's paid for with taxes. It's just, and I think the biggest thing with healthcare and the reason universal healthcare is working for a lot of countries is because it's not so much the way it's paid, whether it's paid out of your pocket after the fact or whether it's paid for in your taxes, but whether it's insurance or whether it's through taxes, right? The problem is that universal health care systems, I'm guessing they basically regulate the amount that can be charged by the providers, by, insurance or whatnot. They don't allow this extortion, if you will, of providers, hospitals and whatnot to charge you $50 a bandage. The bandage is probably at cost.
Right.
And so that's the major issue right there.
50% of doctors report problems with getting patients meds or treatments because of coverage restrictions. Only 15% of doctors in the UK reported having these problems.
77% of people in Britain support the NHS and are happy with it. Would you say that you are happy with the United States healthcare system?
No, definitely not.
No, and I'm actually pretty lucky because I work for the university, so my insurance is pretty good. And even then, I'm not happy with it.
That's a loaded question. I have insurance, and it's good insurance through my husband's company, but we pay through the nose for it. If it were free, I would love that. And if we only paid $350 a month, that would be a huge deal.
I don't believe that our government should be responsible for providing all of us health care. I think the individuals need to be responsible. They need to have a job. They need to look for jobs that provide benefit.
Okay, so her saying it's not the government's responsibility to provide health care. At surface level, I see what she's saying, but it's not the government really, it's our tax dollars.
Right.
We're getting something for the tax dollars we're paying.
It again, for me, when it comes to a change that needs to happen, the biggest change isn't so much how the money is doled out, how it's paid for. It's more about the issue is that currently in our system, people are allowed to extort other people. Companies are allowed to extort people.
Yeah.
That's the biggest thing. Again, I just used the example of like a $50 bandage because that is a real example I've seen personally on an itemized bill. And to me, obviously, a bandage doesn't cost $50. And they're making money off of charging these insane prices for things that are
because they
pennies.
can. Yeah,
Just because they can.
There's so many people, especially people from sort of like lower socioeconomic backgrounds, who can't get the health care that they need because they just can't afford it.
The premiums are still pretty.
I want to push back on that. I'm not really sure what she means because if you have low income in the U.S., generally speaking, most people will qualify for Medicaid. And so if you just actually go and apply for Medicaid, obviously there are certain limited situations where someone on low income may not qualify for one reason or another, maybe because they could fall under their parents' plan, their health, and that could be what she's talking about. But most low income people could go apply for Medicaid and get Medicaid.
Right.
So, you know.
High. They're not unreasonable, but they're still pretty high. The medicine I have to pay for is not covered that much, and it's not even anything crazy. It's literally allergy medicine, and I still have to pay a fair amount every month for just allergies.
People are more than numbers, and they're more than, the change that you make from, stiffing people out of their health care.
All right. That was interesting. And partially an eye-opener, partially somewhat what I expected.
Yeah.
We had a mixed bag like I would have expected in the U.S. I like some parts of our system, but obviously it's broken. Specifically, the cost to the middle class is absolutely insane. Over the last, 15 years or so, it's gotten worse and worse and worse every year to the point that it's absolutely ridiculous how much it costs. It's unfortunate. It really
Criminal.
is. Yeah, it really is. And now we're at this place to where this year people are literally talking about like not even having health insurance, just going without
it's
it.
It's just such a ridiculous cost per month.
Yeah.
That it's like, well, is it even worth it? Because, I mean, who can afford that?
Yeah.
Fun times over here.
Fun times.
Are you jealous?
I'm absolutely no healthcare expert, but I know enough to understand that there are both good and bad in our system, and the cost is the main thing for the middle class, and we need to figure out some way to solve that. And I think the first thing that we need to solve is getting the extortion taken care of. And if you do that, if we can make sure you can't charge $50 for a bandage, guess what happens?
Yeah.
You all of a sudden, the cost to the government through Medicaid goes down, the cost to insurance companies goes way down, meaning that all of a sudden prices across the board for health care services will go down. But unfortunately, as of now, most likely lobbyists are causing the issue of not getting our Congress to act on changing things for the better.
One question I did have about the UK's NHS system is it said that non-citizens can get healthcare for free. Is that like in emergency situations, like if you're there visiting on vacation, or is it just anyone who's there and isn't a citizen can go to the doctor for whatever reason, however often they want to, and get free healthcare?
Well, I don't know the ins and outs of that, but I have been told before, I don't remember when, but I've been told that if we came over and something happened, like an emergency, we could go to the doctor and the NHS would cover it. We would not have a bill going back home.
That's crazy. I would have assumed we would have to pay because we're not citizens.
Yeah,
we don't pay into it. So
when we traveled overseas to Asia, we bought
we
health
have
insurance.
travel health insurance.
And honestly, I've looked at travel health insurance. If I could somehow figure out a way to do that here, that would be the cheaper option by far. It's some reason that is so much cheaper than actually the health insurance for being here.
Yeah.
I guess because they're expecting it only to be used in case of emergency.
Yeah.
But guys, this was really interesting. And let us know in the comments, what do you think of your current healthcare system? Obviously, I believe a lot of you will love it. But just like any topic, there are going to be things you probably see as pros and cons.
Yeah.
Just like here in this system, the cost is horrible, but there are both pros and cons within our system.
According to the interviewer, I don't know how
77%?
Yeah, I don't know how old the statistic is, but
Yeah.
77% of people were happy with the NHS.
And based off of comments, it seems like most people in the UK are happy with NHS, but we do see people saying how they've had problems, they don't like it. Then that's that 23%. And so I'd love to hear from both sides of the equation. What do you love? What do you not like so much about the NHS? Do you feel like the amount you pay in taxes towards the NHS is fair for what you get?
Right.
I've heard people say that they feel like it is most of the time. But, you know, anyways, guys, let us know. We appreciate you. Thank you so much for stopping by. Please click that like button. Feel free to drop your comments or suggestions about this video or others. And don't forget to subscribe to continue to follow us on our journey. Until next time, peace.